Hello. Today I want to share with you some good news. Not only are we seeing the transmission rate drop below 1, we obviously have the tremendous availability of boosters and the excitement of the fact that the data has been submitted for the children from 5 to 11 years old. And so we anxiously await the results from the FDA of their review of that. All of this is very exciting because it's just more tools in our toolkit in reference to being able to stop the spread of this virus. And while many of you said to me, look, I'm young, I'm healthy, I don't need to worry about this, it's the people that you impact. And even if they have vaccines, if they have underlying conditions, it still can cause them to have great illness. And so that's why we continue to urge and push for those who have not been vaccinated to get vaccinated. For those of you who are now eligible for your booster, here are the criteria that are used, and here are the hours that we are open. I'm very excited to let you know that we have administered over 3,000 boosters across our 2 campuses in our 2 locations. And that is all good news because it helps those who have already been protected reinforce that protection. So thank you for all of that. And again, we are tremendously grateful. And when I talk to you about the gratitude, I want to talk to you about one of our own employees, Nathaniel Ale. Nathaniel wrote to me to tell me his story and share that he not only works in our ER and is a nurse with us, but he has a son with Down syndrome. And he said, here's the issue. Not only do I fear for myself, but I more importantly fear for my son, who has underlying conditions as well as his Down syndrome that I know if this impacts him will cause tremendous harm. That's why we make some of these decisions. Even if you're not comfortable, I ask you to think about him and his family members and those that he worries about when he puts his head on the pillow at night. It doesn't slow him down from being on the front line of the battle. He knows we need him there. We need every healthcare professional we have right now and every support service person. As I've been walking through the hospitals and touring, it is hard. It is hard to continue to rally ourselves to move forward, but that is what we do. That is what we do for our community, and that's what we do for our patients. Speaking for our community, we've had some really wonderful opportunities to participate lately in a variety of community activities. First, the Millville Parade honoring Hispanic Heritage Month. That was the first one ever. I'm very proud that Inspira was able to be one of the lead sponsors in this. And here's a photo of our own Joe Durella, who works with us here at Inspira with the governor, and we're so grateful that Joe could be there representing. In addition, we were so pleased to be able to support the Cumberland County Office of the Prosecutor's Day of Remembrance. Madam Prosecutor Jennifer Webb McCrae has been critically important in raising the awareness of all of us in reference to the impact of gun violence, and especially on our young children and their families. I'm so grateful that Andrea Balicki was able to be there that day and provide support as one of our mental health experts to the families, offering both our information about our own programs as well as just comfort at that moment in time. In addition, October not only is obviously Breast Cancer Awareness Month, which is why I wear pink today, but it also, this week especially, is Mental Health Awareness Week. We know during the pandemic that the needs, especially of our children, are so significant, and we need to ensure that we continue to provide resources to people and offer them both at Inspira as well as the state to try and make sure people have access to the things they need. The state put out a whole list of resources this week, which are listed above. If your children are in need of assistance, or you know of children in need of assistance, you can use one of these services. And then lastly, I'm pleased to be able to be supporting the Inspira team next week on Saturday in Vineland at the Alzheimer Awareness Walk. Impacts our communities significantly. It certainly impacts my family and those who we love, and we just have to continue to work for the research and also make sure that we can get people the access to the care that they need at this most difficult time for both them and their families. I'm thrilled to tell you about some awards that have been received from the American Heart Association, both at Vineland and Mullica Hill. We're very proud of our teams who continue to strive and aspire to make sure that we not only are living and impacting the best practices put out by these associations, but we're also receiving special recognition for them because we exceed the standards and continue to move forward for you and for our communities. And then lastly, I want to tell you some special news. Our own Claire Sapienza-Eck, who is the Chief of Strategy and Planning for Inspira and has been with us over 20 years. She has received the New Jersey Biz Top Women in Business Award. We're so very proud of this recognition for Claire and so very grateful for all that she's done. I think she told me she's held every position, whether it be marketing or business development or whatever was needed. Claire stepped in and did it for both Inspira and all of the legacy organizations. And I'm especially grateful to her because she stayed on an extra year, even though she was ready to retire and had promised her husband Charlie that she would be doing that. I asked her just for 12 more months, and I am so grateful that she indeed gave us that and that we are benefiting from all of her expertise. Thank you, Claire, and thanks to each of you. I am so tremendously grateful that we continue to get the chance to walk this walk together and fight this terrible pandemic. And so until we meet again, be well and stay safe.